Thank you for listening to the second update on what's happening with mountain rescue in the Lake District. Since I last spoke, there's been significant changes. The weekend has just passed, was extremely busy on the mountains and valleys, and indeed the mountain rescue teams of Cumbria attended 4 call-outs. Following the announcement on Monday asking people to stay at home, there hasn't been a single rescue, so that's really good news. So thank you from all the teams in the Lake District to those people who've stayed off the mountains. Also, the British Mountaineering Council, which is the body that basically represents all the mountaineers, climbers, fell walkers, they've put a press release out basically putting climbing, hilltop walking on hold for the foreseeable future. So I know it's very difficult. We as mountain rescuers are finding novel ways of keeping fit, cycling, taking our rucksacks out on sort of areas where there's lots of steps, but basically keeping ourselves fit. The real reason for actually trying to get these messages out is very much about protecting our National Health Service and the healthcare providers. You'll appreciate that within Mountain Rescue there are 400 volunteers, many who are first-line National Health Service personnel, including consultants, doctors, nurses, paramedics, ambulance drivers, also frontline officers in the police force. So keeping them safe is really crucial. That's why I suppose out of our just under 400 volunteer team members, around 20% of them are now either self-isolating or unable to actually come on call-outs. And we foresee this figure growing as well. And that's why I think when people go out and about trying to get that exercise, which is good for, physical body plus your own well-being, just to think a little bit more about being responsible about what you do. Taking risks on adventurous activities can result in 999 calls for the mountain rescue team, and we're trying to reduce those numbers of call-outs as much as we can. If we attend a rescue, and of course there will be people who are going out on walks, low-level walks, away from the roadside, who perhaps don't even realise that they've got the virus or are still in a period of isolation. Our team members, they're CAS carers, but they have very limited personal protective equipment. We'll have surgical gloves for stretcher carriers. We'll have masks that we can put on the casualties to prevent infection from them. But also when we get back, we'll have to decontaminate vehicles and equipment. So it really is important to carry on the good work that you're doing, and that's staying off the high fells, to make sure that the numbers of call-outs are absolutely kept to the minimum. So thank you for listening, and I'll keep you updated as we progress through this very, very difficult period. Thank you.